Good morning, Namaskar, good morning to everyone. This is small talk, brief talk about worst situation of COVID-19 in our Bharat, India. I'm calling worst because I've been watching, I'm keeping an eye on this for many months, but there is, I think, determination by government not to worry about this situation. And title being Bharat, India, an analytical informative talk on COVID-19 plus variant strain status for January 6, 2021, reported on January 7, 2021. Government of India provided database worked out spreadsheet, file, screen share for national awareness for government which has been sleeping. It's really very serious issue. Very, you can say, it should be considered serious as top profile, but I don't think whether or not there exists some profile. There's no profile. You can see this file meant for you, this file, and this laughing graphics, smiling graphics on people of this country. And before moving further, we'll speak about yesterday's statistics here. This is I divided this into certain statistics portion. Is this one, which is government given. This is government given, and this is analytical part. I'm sorry, no. This is analytical part of this projection. This is graphics, and this is also graphics, and this is government statement. And here is what is expected, worry, concern, everything. So there's some extension here for many days. What we're talking of, let's first go through what happened yesterday's statistics. And this is your states names, and this is local total cases. I'll speak about this. Maharashtra 19.54553 lakhs, Karnataka 9.24137 lakhs, Andhra Pradesh 8.8376 lakhs, Tamil Nadu 8.23181 lakhs, Kerala 7.90882 lakhs, Delhi 6.28352 lakhs, Uttar Pradesh 5.90339 lakhs, West Bengal 5.57252 lakhs, Odisha 3.309221 lakhs, Rajasthan 3.11111 lakhs, Telangana 2.88789 lakhs, Chhattisgarh 2.85586 lakhs, Haryana 2.63887 lakhs, Bihar 2.54014 lakhs, Gujarat 2.49246 lakhs, Madhya Pradesh 2.46048 lakhs, Assam 2.16424 lakhs, Punjab 1.67910 lakhs, Jammu and Kashmir 1.22049 lakhs, Jharkhand 1.13034 lakhs, Uttarakhand 92,593, Himachal Pradesh 56,015, Goa 5,150, Pondicherry 3,833, Tripura 332, Manipur 2,848, Chandigarh 2010, Arunachal Pradesh 167, Meghalaya 1,352, Nagaland 1,195, Ladakh 958, Sikkim 595, Andaman and Nicobar 4, Mizoram 42, Dadra and Nagar Haveli 3, and Lakshadweep 0. This is tally of yesterday. Whereas there's cases like active numbers, discharge numbers, and death numbers converted to their percentages, and that's here. Active ratio, discharge ratio, and death ratio in these three columns, which is taken into our consideration for purpose of this one, which is very important here. This again, I time again say that status is required for these three controls. These three controls: testing control, treatment control, and discharge handling. Discharge cases handling, you can say. Discharge cases handling. You may say this way, handling, let us say, in a professional way. Discharge cases handling. Number one consideration is control on testing, which is very gigantic task, very important task, must be given priority. But so far there is no priority on this task. Then treatment comes next, to then follow-up of testing. When you to testing, you expose people, you find out how many people are patient. So you start their treatment. That may be about, you can say 5%, 3%, 4%, depending upon whatever figure it is. It depends on how many people come out of patients. And you can say that they are saying few percentages only, 3 or 4, whatever it is. It depends on that. And then discharge cases handling those who have come out of isolation rooms or from hospitals after getting treatment and relieved from there, though not recovered from this, but just you can say they can move in their life. What should happen to do if suppose they are reinfected? These are points. So you can say, is there an infection or not? We'll talk about this in testing cases. Is there good infrastructure or not for treatment? So we have very concerned about this issue, and this can decide about all this. To contain means what is required is to contain this problem, to defeat this problem, to suppress this problem, of whatever term you can give to this, how to overcome this pandemic or COVID-19 strain and variant 11 expected X. So these are points that we have to see. This means questions for these three we have to answer about whole population, what have to be done, what has been done, what shall be done. And milestones, are they existing, where are they, or why they are not existing, why have we worked out this question. Then control, what control we want. We have to find out solutions. Can we do it? Can we chart that out for all these three? Testing, treatment, and so this is what we have to discuss about this. Now it's going to be more and more elaborate every day, because we have to think professionally and find solutions for people of this country, which government's duty is to do that constitutionally and statutory according to this. But are they doing that points? They are doing or not? We can see from this graphs. These graphs you can see deaths and all that. This is population graph here, and population growth, and this is, you can see various are here, and we can see that death graphs and Government of India statement, which is very, you can say, you can read that in my posting. I'll tell you later on what is that, because it's a part of my posting as well. So just you can read yourself. Means what the Government of India is taking all necessary steps, they say. Government of India is taking all necessary steps to ensure that we are prepared well. हम अच्छी तरह तैयार हैं. भारत सरकार कहती है कि हम तैयार हैं. सवाल ये उठता है, तैयार हैं तो नहीं, सवाल ये उठता है. ये बहुत इंपॉर्टेंट सवाल है. अगर हम समझे तो नहीं समझ सकते, कुछ नहीं होगा फिर इसको. मैं पी लेता. अगर हम तैयार नहीं हैं, सरकार तैयार नहीं है, तो क्या होगा? गवर्नमेंट ऑफ इंडिया is taking all necessary steps to ensure that we are prepared well to face the challenge and threat posed by growing pandemic. Growing pandemic. Is that correct? We have to see that. Is that point correct? It's not why they it like this now. With active support of people. You say with active support of people, is there support? Saying with active support of people of this country, we have been able to contain the spread of virus. Support was there or no support? That's the question. Have we been able to contain this? क्या हमने इसको रोका? तो कहते भारत के लोगों ने पूरी सपोर्ट दी और हमने इसको रोक दिया. क्या रोका? क्या संभाला है इसको? क्वेश्चन है. With active support of people of this country, we have been able to contain the spread of the virus in our country. Most important factor in preventing hazard, preventing spread of this virus locally is to empower citizens with right information. Are they giving right information? This is also a question. क्या हमको पूरी सूचना मिल रही है? नहीं मिल रही है. Empower citizens with right information, taking precautions as per advisory issued by Ministry of Health and Family Welfare. Question, is ministry competent? हमें तो डाटा भी पूरा नहीं मिल रहा है. So we talk that we are not getting data. So let's see how it works. Again, I say, same as I talk daily, this projection worked out is very important. I everyday explain, no need of explaining. This clearly says that 1.2% death, 1.2% death, and it says 1.9% active cases. 1.9% active cases along with 1.2% death. This means you can say 3.1%. I think that is right here. I think put here like this. Okay, this is 3.1%. You can say, let's push it down. Okay, fine. So 3.1% you can say jeopardy. 3.1% jeopardy. Jeopardy means खतरा, बहुत बड़ा खतरा. We have 1.9% people in action of this, in attack of this, and 1.2% gone. So 3.1 is a big figure for our country. For our country, it's big figure. Because 3.1 means about 4 crores. Multiply by 1.3. If you say 1.3 multiply with this, how much is that? Plus 3.1 into 1.3. You can say, I think error, PG 40 plus 1.3. I think something like this into 1.3. So this is 0.04% into 100 into 100. 4 crores. This is 4 crores. Government itself is accepting that 4 crore people are at risk. Okay, 94 have gone. Agreed. Also, some is not 100. That's also true. This sum is not 100. No problem. It is 3.1, 94, 97.18. Maybe some people are somewhere else. We'll talk of them later. We are keeping 4 crore people at risk. Even is a joke. That's the reason I'm putting this. They themselves saying that. I'm not saying. They are saying for percent of the population that is here. They are saying for this 17.8 crore, 84 crore, 17.84 crore they say. 17.84 crore people, and they are saying that 3.1%. But we have to take overall population. Now, if we take overall population, and we see this up to 2 years period, different time, you can say 3 months average, 3 months, or you can say quarter of a year, that we have to directly apply it now. No need of explaining everything. This is 4th, 7th, 10th, 12th, all quarter months. This becomes 1.56 crores. 1.2 goes to 1.56 crores, right? This goes to 1.56, so that's death in crores. And we should take this also 1.9%, otherwise it's wrong. Anyway, we'll take that one, no worry about that. So you can say directly now 1.56 crores, 1.95 crores, 2.44 crores, 3.05 crores, 4.77 crores, 3.81 crores, 4.77 crores, 5.96 crores, 7.545 crores, and 9.31 at end of 2 years period. This is our data, which is here, and here you can say that's death here, and here is death. You can say, I think maybe it's not, death percentage, that is crores death, that's here crores death. This is here, this is population here, and here is population crores. So this is that one, and it's this entirely here, which is very dangerous. Now we have seen that. Now I change it, and let's say or we keep separately was on the same thing. If we get 3.1% here, then we have to increase that as well, you know. But let us start this way. We keep 3.1% here, so this goes like this. You can see now how graph is crashing and this rising. You can see this. You can see this. This is up to a tune of 24 crores. Means so many people can be affected in coming time. And by now it's 9.84 crores at 10 crores. By now we say 9 crores, by now it's 9 crores. So it will rise. We'll go back to one, and we can make separate entry for this, no problem at all. We can sum up and make separate entry for this. I'll do that, no problem at all. We have to understand that this is a very serious issue. You cannot deny this fact. आप मना नहीं कर सकती, ये गलत है, ये सही है. हम जो बता रहे हैं आपको प्रोजेक्शन है और ज़्यादा भी होगा, हो सकता है. हम तो इसको नॉर्मल टाइम के हिसाब से ले रहे हैं. और अब आइए यहाँ पे, ये बहुत बड़ा इशू है. इसके लिए we can talk a lot, we can think a lot, we can decide a lot, and we can contemplate a lot. It depends on government policy, but there is no policy. Some people responded on my post that vaccines are coming, so loss prevention is available. These innocent people don't know what vaccine shall do. That's the problem. They don't read news. Vaccine is not for treatment. No vaccine has been manufactured till now, or developed till now, or researched till now, or discovered till now that can treat this, because symptoms only we know. We don't know pathology of this disease, this virus. And because we don't know pathology, how this works in body, how this originates, and how does it go somewhere else from organ to organ, nobody knows this way or that way. We only know there is virus. I'm not doctor, but scientists say they don't know anything about this. Some French scientists declare that it dies at temperature of 92 degrees Celsius. So that temperature is very high. There's no environment. There's no atmosphere temperature at 92 degrees. So and heat cannot kill it up within environment. If you boil water, it can kill that. Or you drink 90-degree temperature, it can. So it's different. It's not possible. So this is very long discussion. And my challenge to government is this: what are you doing in this regard? You can read all these, because this is not one day game. This game is going to, in this period, 24 and 29, a period of 5 years. What is uprising curve, and then another period of 5 years called is down, or you can say diminishing states. This is what we expect. Where do we stand? England is thinking, France is thinking, Italy is thinking, Germany is thinking, Greece is thinking, and many other nations are thinking. America is in doldrum. About 4 crores may die, 4 lakhs may die, 5 lakhs may die. 2 million cases have happened, maybe 3 million, who knows? Nobody knows. So we cannot keep ourselves in isolation. Or we try to keep, we have done everything. We are just spreading something. See, vaccines have come and we will vaccine you and you'll be okay. No, you are not going to be okay. First of all, vaccines are not reliable. We cannot say these are reliable, not guaranteed, not warranted. Yet you can say, to some extent, it will help you. These vaccines would help you raise your immunity level. That's okay, fine. But shall these prevent you? Shall this stop you from contracting virus? That's the question here. So we'll come back to this discussion. Let's go to sheet 1. You can see this curve. This curve is still down, not because of reality, because of fiction. ये वास्तविकता में सच नहीं है, ये वास्तविकता नहीं है, ये एक कल्पना है, एक नावल है कि हम दिखाए जा रहे हैं रोज नीचे दुनिया को खुश करने के लिए. रोज दिखाए जा रहे हैं। क्या दिखा रहे हैं आप बताते हैं आपको। हम क्या दिखा रहे हैं देखिए, हम रोज ये दिखा रहे हैं 20,346 हुए कल। yesterday positive cases that were recorded 20,346. This is what they are saying and they are happy with this. They chant, they thump their waist. ऐसा क्या है कि सरकार अपनी कमर तो थपथपा रही है। देखिए हमारे केस कम हो गए, 97,000 से कम हो गए। ये 97,000 देखिए कितने दिन पहले थे। ये है 97,000, यहाँ है, किधर है, ये रहा। Yes, it is here. 16th entry. 16th entry this is, and this is 11th September. This was saying, ये साहब आप तो देखिए कितने कम आ गए हैं, बहुत तरक्की की, हमने सब संभाल लिया। आपने सब संभाल लिया माना, आपने 20,000 रुपये ले आए माना, लेकिन किसने 17 करोड़ 84 लाख में। गरम है। 17 करोड़ 84 लाख में, 17 करोड़ 84 लोगों के टेस्ट में आपने जितने पॉजिटिव निकाले वो है 1,03,95,278। Out of these tested people, individuals who are 17 crore 84 lakhs, you have registered 1 crore 39 lakhs patients, and out of that is 20,046 yesterday. Mind it, yesterday. And you tested 9 lakhs 37,590. आपने 9,37,590 का कल टेस्ट किया, जबकि पहले आपने 11 के भी किए हैं, ज़्यादा के भी किए हैं। 11 के तो आपने किए हैं, 11,58 के 11.5 लाख से ऊपर आपने टेस्ट किए हैं। 11,70,000 भी किए हैं, 11,70,000, 11,57,000, 58,000 you tested in past. 11,93,000 you tested. So why 12 lakhs? 12 lakhs also you tested. And also you tested, yes, you tested 12 lakhs, 69,000. Yes, 12 lakhs, 69,000 you tested. There's record. So why you are not testing 12 lakhs at least? You're not doing that. You're dropped. And in last week, there's a drop of 20%, 107, and now 140 in 7 days. 1, 2, 3, 4. Okay, let's say 20% drop, which is considerable one. When you compare from 12 lakhs, it will be much more. I'm not going to that way. We can say, okay, 12 lakh something, it is 12 lakh, what was that? 12 lakh, more than 12 lakh, it was even 14 lakh 23 here, we can see 14 lakh 23,000. So we can say, if just say 40 lakh 20,000, we write there, we can know how much drop is. Let us say I can say 12. If I write here 12 lakhs, maybe don't give, I think, don't give 12 lakhs 50, 33%. If you take that one, 33% you are down. It's surprising. So why are you down? Why government is down in testing? That's point of concern. Point of very powerful concern it is. Why is that down? My point is that why is not up? This means we are not doing our job. It means we are not doing our job. In 313 days, we have tested only 13.723%, which is per day 5.69971 lakhs.
when we can test 12 lakhs with our current resources? Why don't you do that? And why don't we increase that? That's the question. सो क्यों रहे हम, सोच क्यों नहीं रहे हम? Or you may say, people come on their own and we test, we don't go to them. That you may say, and that's what's happening actually. Nobody has come to me for test so far. Nobody has come to my home so far that we are going to test you. My sister was tested because she was sick and we called laboratory and she was tested. There is no mandate from government, from nation that people are to be tested. This means if you are sick, you feel something, go and either go to government center, get tested, or go to call private laboratory and they will test you. Spend money. This means government is not concerned with your health. To be very frank, this is a fact. This is a fact of the situation government is least bothered about. So well, we go further and say what's there. So we say 5.69971 lakhs per day average, and we tested yesterday. I've given you already here. 112 crore. Ali. 112.16 crore people are sleeping without test. Right? They do not know what's happening to them. And government says they are doing everything. They have been successful in controlling this virus. It's a ridiculous statement, I should say. It's not even political statement, it's childish. This statement is childish, you can say, not even political statement. Had it been political, I would have said, okay, fine, there are politicians who are doing that. ये राजनीतिक स्टेटमेंट भी नहीं है, बच्चों वाला स्टेटमेंट है, गवर्नमेंट बच्चा बन चुकी है. 86% people do not know what is their fortune in health. And we can say 20,000 people have died. I'm sorry, I captured this yesterday, and 150,000, 1.5 लाख के करीब लोग मर चुके हैं, जा चुके हैं. अब छोड़िए इन बातों से क्या होगा. अभी हमें ये सोचना है कि ये 20,346 जो एक फेक फिगर है, इट्स अ फेक वन. What is reality? Reality is this. In keeping in view means here we say it is average here. I'm sorry, this one M114. M is this. This is 114. Number of people who were declared positive yesterday, and if you multiply this by population and divide by F114, which is total number here, we get 148,260 in place of 20,346. 20,340 का 1,48,60 बनते हैं. No, no. You can think. You can think what we are doing. Are we joking? Or is government a joking instrument? Our government is joking instrument, or our country is joking instrument? I don't understand what we are. 1,48,260 calculations are telling, and they are saying 20,346. They're not telling about this, because this is related to this. And this is not given there. We have to include this, so it goes to 148,260. And 9 crores out of this calculation, according to government data, this is what I say, it is 9 crore expected cases in government calculation, but when I say, I multiply this and this is 35 crores. All right, we go to something else, and this is here. These 4 days. In this, I know I am taking, this date, this data, and this data. 4 data. So here I am taking it. for further analysis, you can say, this I am taking here, and it is, this says that 2.17% detection of cases out of tested numbers. You mean to say how many tested in one day and how many have been declared positive. This is that percentages for this one. For previous day, it is 1.994%, and for day before that is this is 1.83%, so 2.4 before that, 2.24. So average of these three, this four is this, average is this, 2.05% every day of whatever number tested. So you can say here, if this applies to whole population, in one day, if you test them, you will find 2.66 crore immediately. You got my point. This is calculation. I'm not saying something different. This is what I say, explosion is there. We do not know, we have to uncover that. And here is, there's some figure, leave it behind me, so I don't want to confuse you unnecessarily. Well, now, what is there actually? Our important point is when we discuss about sheet 5 here, when we discuss about this issue says that testing is a question mark. We have to solve this problem. How? Testing, you can say, is one domain and treatment is another domain, which is longer one. Testing can be done in one day and followed by that is treatment. That takes time. Testing of a person just takes one day and second day you can give result, or even same day you can give result. So testing is easier, in fact, if we move on testing of everyone. If government policy is changed, actually there is no policy, so I should not say it's changed. Government has to evolve a policy. I don't know government thinks what way, but we are thinking differently. I am thinking different way. Government has to chart out a policy how to test people. That is most important here. And you have enough staff, plenty of staff with you. There's no dearth of staff in our country. People can be engaged temporarily, and you can go and test 112 crore people. You have plenty of staff, medical staff, non-medical. Just testing means it's coordination work. You collect sample. Only for sample collection, medical has to go, paramedical has to go. And then testing will happen. Other supporting work can be done by other people. So the testing, I think, is first milestone that should be decided with many milestones each state. And it may be done in 3 months maximum. It can be earlier. Okay, we give you 3 months, no problem, or 6 months maximum. And control comes, control of treatment. Treatment is 17 days minimum, and it can move to months, depending on cases, what degree of cases, or you can say stage of cases. So you don't have infrastructure. Testing infrastructure can be immediately created. Augment your resources, employ people, use them. You may say 6 times or 12 times, in that range. You augment your resource, multiply your resource, and testing is first solution to win this problem. Treatment shall take many months, and because you don't have any reliable infrastructure to contain this work, you have to create temporary infrastructure within a couple of months. You can do that, not very big deal. Do it. You need quarantine, isolation, and you have protocol for medicines in normal cases, and very serious cases you have different ventilator requirement or oxygen requirement or whatever else, heavy good food requirement. So we give time in that, but that is only maybe you are saying active cases and death, which is just 3 or 4%. So just for 3 or 4% of population, you cannot keep other people on risk. Can you keep 87% people or 90% people or 95% people or 96% people at risk? 96% of those who have not been tested, I'm talking, say 86, 96%, 70, 80, 78%. Can you keep them on risk? That's the point here. You have no right, actually, being a government, you have no right. You can nationalize hospitals, private hospitals, you can nationalize nursing homes, you do whatever you can do, but you have to do this. Treatment is supporting, and then you have to think of long-term planning for those who have been discharged. Because discharge doesn't mean recovered, it means another expectation is that they may be reinfected by variant or by strain or by expected X. This is very important point. How to handle those people? This is what we want to know from government. And government, I don't know whether they are contemplating on this or they do not want to listen anything. That's what I say. This is what I mean to say. We can talk a lot, but no need of talking a lot, because we understand we want to change this graph. We want to change this graph, and we want to write right statement with this a fake statement by government. We don't want fake statements, real statements, virtual, not virtual, real statements. We want to see what's happening on ground. This is very important fact which you have to understand. As I said, 3 to 6. 3 to 6 months. 3 is 12 times results addition, or you can say multiplication, augmentation. And 4 months, if you say this goes to 9, and if you say 5 months, it goes to 7. If you say 6 months, it goes to 6 times. So 6, 5, 4, 3. Right? You can say, I say 6 times. If you say 5 months, it is 7 times. If you say 4 months, it is 9 times. It is 3 months, it is, so in this range it is 6, 7, 8, 9 and 12. 6, 7, 8, 9 and 12. You have to, in this range, empower your resources, and you can solve this, you can say, impending issue in public interest. This is job of government. Who wants to wait for 3 years or 3 something? And who wants to wait for 1107 days? That is complete jeopardy. You want to keep people on jeopardy for 3 years? It's not acceptable. You have no right to keep people on jeopardized situation, on emergency situation, a situation which does not give anything to people of this country, but keep them in darkness of health hazard, super health hazard, you can say, and we have not to go to that level. So government has to open its eyes, people have to open its eyes, people have to use their tongue, use their speaking power to raise issues to government. You have to do something. Do it, or you are causing problem to people of this country that we don't expect and we don't accept as well. This is very important point. And before this I go further, I speak about submission. As I already said, that variant, strain, or we call them plus, are arriving and have arrived already. So government claim, which I repeat for everybody to understand, Government of India is taking all necessary steps, they say, I'm not saying, to ensure that we are prepared well. Are we? Question is there. Some say, oh, we are very well prepared, we are pouring vaccines. No, that's not required. That's not what I say. We are not prepared well to take care of people. Not prepared well to take care of people. That's the main point here. And with thinking and saying is very tragic, very tragic. We are not prepared well to face this challenge. They are saying we are prepared. And they say threat posed by growing pandemic. Yes, it's a threat, super threat. And they are saying we have to support the people of this country. People shall support if you do something, but you are not doing anything. You are just publishing data, you are just declared lockdown before also, and during that lockdown period, you did nothing. You have been able to contain spread of virus. How? Where? How? Who? I don't understand. Where is control? I don't see. Where is containment? It's not there. So, most important fact in preventing spread of virus locally is to empower citizens with right information. Where is information? I'm not finding any information except useless information. And taking precautions for advisory being issued by Ministry of Health. And which advisory have issued? I don't know. Work that you have to do, you are not doing. Then there are posts, there are various posts here that you can say about posts, 33 URLs and videos which are about 46. Then you can say, statistics I have posted, you can see complete post there. Just for information, I'm saying that COVID-19 strain variant report update on this date, 7 January, forenoon. Bharat public must think very seriously about how to achieve risk loss prevention. That's what my point is, that risk prevention is a must, and we have to be careful about that. It's better to achieve risk loss prevention by application of required pertinent measures. Vaccine is something else, it's not risk prevention. It's just giving immunity. And even after vaccination, nothing is guaranteed. There have been cases after vaccination, people have contracted this disease. So, because nothing is being seriously done by our nation, we have to think our building always remains prone to fire. Just an example, it's just an example. Building always building में आग लगी जाती है. But if loss prevention methods are applied, loss to life and property can be minimized. So this also applies to COVID-19 plus. A possible magnitude of risk must be understood or evaluated by analyzing its power, and then based on analysis, practical application solution must be searched and finalized prior to it's too late. भाई एनालिसिस कीजिए, बात को समझिए, कहाँ पर कितना बड़ी रिस्क है उसको समझिए, पब्लिक के इंटरेस्ट को देखिए, अपने इंटरेस्ट को मत देखिए, पॉलिटिकल इंटरेस्ट को मत देखिए, और आगे बढ़िए. COVID-19 strain variant has already spread in many countries. There are so many names you know, all that Bharat, Canada, UK, Australia, European area, Germany, France, Greece, Italy, Singapore, Hong Kong, Sweden, Jordan, and many, many more. भारत इंडिया हैज़ क्रॉस मैनी डेज बैक ऑन. कई दिन पहले हमने 1.035 केसेस को क्रॉस कर लिया था, करोड़ केसेस को. भारत इंडिया हैज़ क्रॉस मैनी डेज बैक 1.035 crore COVID-19, and also many cases of variant strain have been reported from various parts in Bharat, India. Now, individuals out of 130 crores, only 17.84 crores, or only 13.723% population tested. We are given data. And 86.277 population still, percent population still after. So we have given this data. No worry for COVID-19 strain plus. Government of India कोई चिंता नहीं भारत सरकार को, और people of भारत के लोगों को भी कोई चिंता नहीं है. As most people of ours have become sheer careless. हमारे लोग भी लापरवाह हो गए, बुरी तरह से लापरवाह हो गए हैं, और गैर जिम्मेदार हो गए हैं, and ignorant, जानते नहीं है क्या है. No worry for even COVID-19 strain plus on government of India, people of Bharat, India, as mostly people of ours have become sheer careless, irresponsible, and ignorant. Sorry, excuse me. No plan is available for remaining 86.2% population who have been remaining untested, which has made it impossible to fix certain required milestones and schedule out prospective time-scale-based plan to combat COVID-19 impacts. It's must to have concrete schedule a plan to control COVID-19 plus. Just avoid its powerful explosion that could cost crores lives directly and many crores additionally affected. Testing has been non-conducive, extremely unsatisfactory, which means no plan can be charted out present state. Real state of future of COVID-19 in Bharat India cannot be correctly either forecast or predicted analytically. In this connection, I had sent mail to government many days back, but there's no action from government. I didn't find anything specific. No information of the pertinent any plan has been received from government, and I don't expect any more either. Never expect the governments of so highly responsible. No change or accelerating program is visible, no prediction of any program is available on the website. In fact, testing is still really outstandingly unsatisfactory. There's no impact on their health, even prior to something, whereas government has always tried to reflect the least number of positive cases by manipulation of data. Openly, I am criticizing this. No reported indications seem to be part of Government of India to extend testing the whole population is concerned, and if in case of no right reliable data, no precisions can be reflected. Government of India doesn't take any responsibility for testing of common citizens, assume to be responsible citizens themselves. We don't yet to do ourselves. Government of India has distanced itself from owning the public health responsibility, and the details we have given of number of cases. So the test conducted so far 17.84 crores, and on 6th yesterday conducted 9.37 lakhs, and total corona infections till yesterday 1.039 crores, and positive cases till yesterday 20,000, only yesterday 20,346. That is manipulation, and that's 153.36 so far. And population tested 13.726, and remaining 86.277 not tested. Time required for whole population testing but 1283 days and 1107 days. Time required for remaining population testing is 1107 days. This required period is very questionable. We have to think of this, or this active accept this too long period, more than 3 years. This point is very powerful to understand. Can we come out of sleep? हम सपने से बाहर आएंगे, स्वप्न से बाहर आएंगे, हम उस स्वप्न से जिसमें हम कोरोना को चैलेंज कर रहे हैं उससे बाहर आएंगे. मैंने देखा बहुत से लोग कोरोना को चैलेंज कर रहे हैं. ओ कोरोना कुछ नहीं है तो बताओ हमें कहाँ है कोरोना. अरे भाई ऐसी बातें मत करो, देश के माहौल को मत बिगाड़ो कोरोना के नाम पे. कोरोना है, आपको समझ नहीं आ रहा, सारी दुनिया में चल रहा है. यहाँ पॉलिटिक्स हो सकती है कि सारी दुनिया में पॉलिटिक्स चल रही है, इसलिए गलत फहमी का शिकार मत बनिए. मैंने देखा है पब्लिक भावनाओं में बह जाती है. Alright then, why is government not improving its bad performance? That's a question mark, big question mark. And government don't respond to any question. Government भूल गई है लोगों को. Government has ignored poor, lower class people. क्यों सरकार सो रही? Why is government sleeping? No answer. And public too sleeping, unknown for real state of public. I'm surprised. Government doesn't look serious, doesn't look anxious to test all citizens. That's true, because there is no testing from government and only people are going and getting tested. Why should people of Bharat suffer for none of their faults and pay a lot? Why should people of Bharat suffer for none of their faults? Only suffers are poor people at lowest rank of society who cannot afford testing cost and treatment cost. And those people who may suffer or have suffered, they have not raised their voices. There is no voice, and they have become virtual slaves. Though they are not slaves legally, they have become virtual slaves under current Modi regime. Why has the government left its responsibility on the people, on themselves? And because where the funds are going, question is that where are funds going? Funds were taken on PMK. Where are those funds? There is no one to ask this question. It seems all people shall not be tested because till now no such policy exists and no such addition is expected on policy, really speaking. There is just no government policy towards public handling of COVID-19. Stay plus test yourself, spend money, and then you have to spend 1,200 to 2,400 for one test, one time, and then you have to pay expenses, all expenses, if you are found positive, and you have to engage one attendant also, who charges 1,500 to 3,000 rupees per day for isolation room service. Or you have to get admission into some hospital, that will charge 10,000 to 20,000 rupees per room per day, and then medical expenses, injections, oxygens, ventilators, whatever is there. So it's big risk. You need lakhs of rupees, and even if you are rich, you want to have your own room, and you don't join hospital, you don't get admission to the hospital, even then you need many thousands, because of 17 days you have to pay at least, you can say, about 50,000, let us say 50,000 down, some maybe 25,000 to your attendant and medical expenses, all other expenses, food expenses and stay expenses. So you can say many, half a thousand, half a lakh to many lakhs you have to be ready with. So my dear, this is, you can say, essence of posting is that in a nation where neither public is serious, nor people are serious, nor government is serious, explosion is expected and anticipated. We are non-serious society. We are not thinkers. Our thinkers, our intellectuals are not speaking. I don't know the reason behind that. Are they afraid of what? I don't know what for they are afraid. They behave as if they have no right or they have no duty towards others. I think that's against the constitution of this country. If you see Constitution Article 51A, you will find that as a citizen you have every duty, and also in preambles everybody has a right to stay safe, stay with food and shelter and everything, dignity, but it's not going to happen here. So we can say we cannot think to resolve problems seriously, and threats are there. We can't wait for many years, and we are all at risk. So we have to speak, we have to do something ourselves. You think yourself, don't depend upon them, do your job yourself. I think that's the only answer. So I can say that do not feel bored about this program. This is very serious program. It shall help nation, and my purpose is to disseminate analytical information, because I do not keep to myself. There's no purpose why just to keep to myself. I work on that, so it's for people of this country, not for me exclusively. So that's why I say करना चाहिए कुछ ना कुछ, हम जितना कर सकते हैं करें, कुछ तो करें, कुछ तो पब्लिक को बता दें. अगर पब्लिक ना समझ पाए, और प्रोफेशनल्स को भी चाहिए आगे आके बात करना, गवर्नमेंट को समझाना. पॉलिटिशियन से तो उम्मीद नहीं करता हूँ, लेकिन पब्लिक से, पब्लिक में जो पढ़े लिखे लोग हैं, अच्छे पढ़े लिखे लोग हैं, जो डाटा को समझते हैं, डाटा को इंटरप्रेट कर सकते हैं. और कितना सिंपल डाटा है, आप देख लीजिए. मैं तो सिर्फ 5 ही डाटा लेता हूँ उससे. डाटा एक कन्फ्यूजिंग प्रोफाइल नहीं है, डाटा की प्रोफाइल नहीं बन रही है. ये बता रही है आपकी, ये देखिए, ये प्रोफाइल है. सोचिए आप, दिस इज नॉट ए प्रोफाइल, जिग जैग ऊपर नीचे उठ पटांग. और इसमें भी कौन सी प्रोफाइल है, आप देख लीजिए, ये भी कोई प्रोफाइल नहीं दे रही है. बस ये राइजिंग माउंटेन है, डेथ का चल रहा है, और इसका कोई सोल्यूशन नहीं आ रहा है हमारे पास. ये बातें बहुत मीनिंगफुल हैं अगर हम सुनें. और यहाँ कह सकते हैं इसके कमेंट्स लास्ट में जो हम यहाँ देख रहे हैं, दैट इट सेज वी आर स्लीपिंग, वी आर नॉट सीरियस, वी आर नॉट डूइंग एनीथिंग, गवर्नमेंट इज स्लीपिंग, गवर्नमेंट इज inefficient, we are a failure in COVID handling, we are not interested to help people to test them, we are not no policy at all, we don't believe in policy, we don't believe in action. What we are, actionless society, actionless government, sleeping society, sleeping government, ignorant people. We don't care. Government is only for name's sake. What to do? We have to solve this problem ourselves. Vaccination is something else. Don't relate to the treatment. Well, I don't know what to say about this. Is now, if we say I started this analysis say from since 31 August, and if in 313 days, which is more than 10 months, if you're not reached somewhere, even after these 110 entries, it's quite reasonable one. Good analysis, preliminary analysis you can say, or some suggestive analysis can be conducted, and is being conducted. It's being conducted professionally based on mathematical calculations, and what we can interpret or construct out of that, we're doing it. I think we, अब क्या करें इससे ज़्यादा बताइए, क्या करें, what to do more than this? I have no answer to that. Time is moving very fast, moving very fast. And COVID-19 has spread its its wings to every place all over this country and all over the world. It's coming back and back, and actually it's not going back. It's not going. We think it's come back. It's still there. वो गया ही कहीं नहीं है, वही है. तो हम कैसे कह सकते हैं सेकंड वेव और थर्ड वेव? WHO की अपनी अपनी बातें ही छोड़ो उनको, और न्यूज़ वाले क्या कहते हैं उनको भी छोड़िए, चैनल्स क्या कहती हैं नहीं कहती हैं. और एक तरह से कहिए तो सरकार कभी भूल जाइए. जो सरकार इतना सा काम नहीं कर पाई 10 महीने में, 20%, 50% भी टेस्ट नहीं कर पाए, बाकी तो छोड़ दीजिए आप, 25% भी नहीं कर पाए, तो उसको आप क्या कहेंगे? अब तक 80%, 90% से बल्कि कहिए तो सारे टेस्ट हो जाने चाहिए थे, तो ये भी नहीं कर पाए, आधे भी नहीं कर पाए, चौथाई भी नहीं कर पाए. तो क्या कहें आप उनको, बताइए. कोई प्रोफिशिएंसी नाम की डेफिनेशन नहीं है हमारे यहाँ. हम नहीं जानते कि काम कैसे कहते हैं, कमिटमेंट क्या होता है, डिटर्मिनेशन क्या होती है, वर्क क्वालिटी क्या होती है, सिस्टम क्या होता है. आंख बंद करके बस चलते जाइए, जिधर को भी रास्ता मिले, और समुद्र में जंप मारे तो मार लीजिए. मैं तो यही कहूँगा इसके बारे में. बाकी आप अपने अधिकार से कुछ भी कह सकते हैं, कोई नहीं रुकेगा आपको. कुछ भी कहिए आप, आपका अपना हक है. लेकिन मैं हक से नहीं, मैं कर्म से, अपनी ड्यूटी से ये सोच रहा हूँ कि कैसे लोगों के हाथ में सरकार चली गई है, कुछ नहीं कह सकते इसके बारे में. बड़ी अजीब सी स्थिति बन रही है. कुछ क्या कहेगा इसमें कोई. शायद कुछ अच्छा होता तो ठीक था, और जो अच्छा नहीं हो रहा है तो उसका मैं क्या करें. It's really very very annoying here. What to do with this? I can't answer this. You have to answer. People have to answer. Government has to answer. Nation has to answer. I am just a proposer. I'm just proposing what to do with that. Nothing more than that. And it's really annoying, and it's really not a good and happy situation. It's very sad, very very sad, and I cannot say.
नमस्कार सर.
Namaskar, hello.
नमस्कार सर.
नमस्कार. Yes, बोलिए बोलिए.
नमस्कार सर.
नमस्कार. नमस्कार. हाँ जी बोलिए.
हाँ सर नमस्कार, शैलेंद्र बोल रहा हूँ.
हाँ जी बोलिएगा शैलेंद्र जी साहब, क्या हाल है?
कहीं ड्यूटी पे हैं सर?
हाँ बोलिए ना.
सब बढ़िया, कोई आप नहीं हैं सर?
हाँ जी. हाँ जी बोलिए.
मास्क लगा रखा है आपने?
हाँ जी मास्क लगा रखा है.
मैंने कहा मास्क लगा रखा है. मास्क?
हाँ जी लगाया हुआ है. मास्क लगाना जरूरी है.
दिखाई नहीं दे रहे.
हाँ
हाँ दिखाई नहीं दे रहे मास्क में.
तो क्या करेंगे देख के भाई साहब, ये देख लीजिए, ले गया कर लो. जस्ट प्रॉब्लम है, मास्क लगा रखा है तो बड़ी को मास्क नहीं लगाएं. सोचिए आप, मास्क नहीं लगाएं क्या? अरे मास्क तो हर जगह लगाना है. मेरे कमरे में भी तो पार्टिकल्स हो सकते हैं. कौन कहेगा नहीं हो सकते? कौन बताएगा? एयर में आएंगे, एयर तो कमरे के अंदर भी आ सकती है, पार्टिकल आ सकते हैं. आप क्या कर रहे हैं, कैसे रोकेंगे इसको? तो भाई समझ नहीं आता लोग. ये देखिए, ये भी एक साहब हैं, इन्होंने कहा आपका चेहरा नहीं दिखाई दे रहा. अरे बात कीजिए ना, चेहरे से क्या लेना है भाई? हम सीरियस बात कर रहे हैं और लोग मस्ती पे बात कर रहे हैं. क्या हुआ बताइए आप, क्या करेंगे आप? एक बात है ना सोचने की, क्या करेंगे आप? लोग जब सीरियस नहीं होते अपनी हेल्थ के बारे में, तो वो देश के बारे में क्या सीरियस होंगे, पब्लिक के बारे में क्या सीरियस होंगे? अपने बारे में जब सीरियस नहीं है तो अपने घर वालों के बारे में क्या सीरियस होंगे, अपने पड़ोस वालों के बारे में क्या सीरियस होंगे? वही हाल भेड़ चाल जैसा. इंग्लैंड वाले नशे में थे. हम तो सी पे जाएंगे, बीच पे जाएंगे, हम तो ऐश करेंगे. वहाँ के प्रधानमंत्री ने भी क्या, जॉनसन ने कहा जाइए ऐश कीजिए. तो जब ऐसे ऐसे लोग हैं जो पता नहीं क्या क्या बोल देते हैं नशे में, पी दारू की बोतल और बोल दिया जाओ ऐश करो. अब वही लोग परेशान हैं, इस हाल पे आ गए कि देश नहीं छोड़ सकते, हमें कोविड को संभालना है, हमें स्ट्रेन को संभालना है, हमें वेरिएंट को संभालना है. इस हालत पे आ गए वो आज. मार्च तक हो सकता है उनका लॉकडाउन चलता रहे। अभी तो 15 फरवरी तक किया है उन्होंने, लेकिन लगता है मार्च तक जाएगा। और वही एक्सटेंशन जर्मन ने भी की है, औरों ने भी की है। वो शायद सोचते हैं लोगों को अंदर रखो तो कुछ हो जाएगा। पहले हालत ख़राब कर ली लापरवाही में, घूमे फिरे, क्लब में जा रहे हैं, होटल में जा रहे हैं, शराबी पी रहे हैं, कहाँ कहाँ जा रहे हैं, रिश्तेदारों के जा रहे हैं, पार्टियाँ कर रहे हैं। और जब पानी सर से ऊपर चला गया, नाक से, कान से, आँख से ऊपर चला गया, तो अब कहते हैं हम बहुत प्रॉब्लम में हैं, हम इतना फाइन करेंगे, हम ये करेंगे, हम वो करेंगे। तो आपकी कोई पॉलिसी नहीं थी, साफ बात है। यूके की बहुत ज़िद्दी आदमी, बहुत ज़िद्दी जॉनसन, बहसबाजी, स्कूल बंद करें खोलें, बंद करें खोलें, इसी में महीनों निकाल दिए। और वही हाल हमारा हो रहा है। हम तो सोच भी नहीं सकते, वो तो सोच भी सकते हैं। वो सरेंडर तो कर देते हैं, उन्होंने किया, चलो ठीक है लॉकडाउन कर देते हैं। यहाँ तो बात करना ही बेकार है, यहाँ तो हर बात को पॉलिटिक्स में ले जाएंगे। खैर, दुख होता है जब ये बातें सोची जाती हैं। और पब्लिक जैसे अभी हुआ कि लापरवाही, अरे भाई लापरवाही है, जो भी कह लीजिए आप, नुकसान तो देश का होना है। आप बीमार होंगे नहीं होंगे, आपका घर वाला बीमार होगा नहीं होगा, बात ये नहीं है। हमको कुछ करना चाहिए था, नहीं किया। इसका दोष मैं देश की जनता को देता हूँ, सरकार को नहीं, क्योंकि सरकार वही करती है जो जनता चाहती है। इलेक्शन की रैलियाँ की गई, हर पार्टी ने की, बड़ी बड़ी भीड़ जुटाई गई। अरे मत देते वोट, या कहते कि हमको मास्क लगा के जाना है, हमको डिस्टेंस मेंटेन करना है, कुछ नहीं, अंधाधुंध। हम जानते हैं कोरोना में करप्शन हो रहा है, कोरोना में हेराफेरी हो रही है, चोरी डकैती हो रही है, लेकिन हेल्थ भी ख़राब हो रही है, इसको नहीं भूलना चाहिए। हमारे फार्मिंग प्रोफेशनल्स का भी आंदोलन चल रहा है, किसान जिसे कहते हैं, वो भी कह रहे हैं कोरोना कुछ नहीं है, गलत बोल रहे हैं, ऐसा नहीं बोलना चाहिए। ठीक है आप भीड़ है, सब कुछ है, लेकिन प्रिकॉशन तो लो। आप हेल्दी भी हो सकते हैं, बात ये नहीं है, लेकिन हेल्दी होने का मतलब ये नहीं कि कोरोना पे कुछ नहीं कहेगा। अभी नहीं कह रहा, बाद में कहेगा, क्या करेंगे फिर आप? बात राजनीति की नहीं है, बात देश के स्वास्थ्य की है। अगर सरकार कुछ नहीं कर रही तो इसका मतलब पब्लिक भी कुछ ना करे। बल्कि मैं तो कहता हूँ सरकार की इंस्ट्रक्शन की हमें ज़रूरत ही नहीं, सारी दुनिया में फैला है, अपने आप को संभालिए। कि ऐसा ना हो कि हम पता लगे एक दिन 25 करोड़ लोग पड़े हैं कोरोना से, या 50 करोड़ लोग पड़े हैं कोरोना से। एक स्टेटमेंट कल मैंने पढ़ा कि जी भारत में कोरोना कम फैल रहा है। पता नहीं कहाँ से न्यूज़ आ जाती है, कम फैल रहा है, कितना 97,000 से 15,000 18,000 हो गया। पता नहीं कहाँ से ऐसी न्यूज़ आ जाती है, इससे कोई सर पैर नहीं होता। आप टेस्ट नहीं कर रहे, आपको पता ही नहीं कितने लोग बीमार हैं, आप कह रहे हैं कि हमने दबा लिया, हमने सब कर लिया। कैसे कर लिया आपने, कैसे कर लिया आपने? सवाल ये उठता है। नहीं कर सकते आप, बेकार की बातें। खैर, अब समझाने का एक शब्द भी काफ़ी होता है, एक सेंटेंस भी काफ़ी होता है। अब आप नहीं समझ रहे तो मैं क्या करूं, मेरे पास कोई इलाज नहीं है इसका। अब समझना तो आपको ही होगा, आप अच्छी तरह समझते हैं नहीं समझते आपको देखना है। और अब मैं ज़्यादा वीडियो और लंबा नहीं करूँगा, 1 घंटा हो चुका है। और इन्फॉर्मेशन भी जो आज मैंने शेयर करनी थी कर ली, कल का कल देखेंगे, कल की बात कल पे। आज सीरियसनेस है, और मैं नहीं समझता कि ये सीरियसनेस, ये गंभीर स्थिति जल्दी समाप्त होने वाली है, ऐसा कुछ नहीं लगता। और हमारे देश का तो साल भी अच्छा नहीं है, ग्रिप में है हम। मैंने चार्ट भी लगाया था हमारे देश का और विश्व का, पता नहीं आप लोगों ने देखा है नहीं देखा है, आपकी मर्जी। तो इसमें क्या करेगा, इंटरेस्ट आपको होना चाहिए, मेरे को है, लेकिन मेरे इंटरेस्ट से क्या होता है? मेरी बात को सुनेंगे नहीं सुनेंगे, क्या वैल्यू? मैं बहुत छोटा सा आदमी, कोई सुनता है कोई नहीं सुनता है, क्या करेंगे उसका? बाकी आपकी मर्जी है भाई। आप देश के वासी हैं, देश के अधिकारी हैं, देश के ऑनर हैं, स्वामी हैं, और सरकार वही करती है जो पब्लिक चाहती है, लेकिन पब्लिक इसका मतलब चाहती नहीं है, क्योंकि सरकार कर नहीं रही है।